Pressure Ulcers by Madison Gallagher, Mi Yang, Stacy Fernandez, and Kate Fernandez. Enjoy.
What are pressure ulcers? These are also known as bed sores and decubitus ulcers. They range from closed to open wounds and are classified in a series of 4 stages based on how deep the wound is. Stage 1, the skin is not yet broken. Stage 2, the skin is broken in the epidermis and the dermis. Stage 3, the top 2 layers of skin are affected as well as subcutaneous tissue. In stage 4, the deep wounds are affecting muscle, tendons, ligaments, and bone. Additional types include unstageable, where the sore is covered in debris and plaque and can't be staged, and deep tissue injuries, where the injury is underneath a layer of skin. In stage 1 pressure ulcers, the skin is not broken and the recovery period is about 3 days. The affected area has no surface breaks or tears, but the skin may appear red in people with lighter skin or blue and purple in people with darker skin. Remain red or darker for more than 30 minutes after pressure is removed, not turn pale if pressed firmly or non-blanchable, be sore to the touch, have a warmer temperature from the surrounding normal tissues, feel firmer than surrounding tissues, or cause mild burning and itching. Some treatments can include using pillows and blankets as extra padding and keeping the area dry and clean to reduce tissue damage. Stage 2 affects the epidermis and dermis, and the recovery period is around 3 days to 3 weeks. A stage 2 bed sore may appear as a shallow crater like wound, a serum filled blister that may or may not have burst, some damage or pus at the ulcer, pain, swollen, sore, or red tissue around the sore, which indicates tissue death or damage. It's important to monitor stage 2 pressure ulcers for any signs of infection. Stage 3 affects the epidermis, dermis, and subcutaneous tissue, and the recovery period is at least 1 to 4 months. An ulcer at this stage may resemble a hole or crater, and it's likely to notice visible fat but not muscle or bone. In this stage, it's important to look for signs of infection, and they include foul odor, pus, redness, or discolored drainage. A doctor may prescribe antibiotic therapy or recommend a special mattress or bed to relieve pressure from the affected areas. Stage 4 pressure ulcers are deep wounds that may impact muscle, tendons, ligaments, and bone, and the recovery period is about 3 months to 2 years. High risk of infection is at this stage, and symptoms include extreme pain, drainage, dead tissue, which may appear black, visible muscles, and sometimes bone, and common signs of infection like foul smell and pus. A dark, hard substance known as eschar, which is hardened dead wound tissue. A doctor may recommend surgery to treat stage 4 pressure ulcers. Additional types of pressure ulcers include unstageable and DTIs, or deep tissue injuries. Unstageable pressure ulcers are also hard to diagnose because the bottom of the sore is covered by slaw, dead skin cells that appear tan, yellow, green, or brown in color, and eschar, hard plaque that's tan, brown, or black in color. Only a doctor can determine how deep the wound is after cleaning it out. Deep tissue injuries are pressure ulcers that may form as a blood blister or be covered with eschar. Ulcers that form from suspected DTIs can be difficult to diagnose because they may resemble a stage 1 or 2 sore, but underneath the discolored surface, the ulcer could be as deep as a stage 3 or stage 4. Treatment can be frequent repositioning of off the site of injury and correcting any systemic issues or nutritional deficiencies.
Pressure ulcers can develop through pressure. Constant pressure on any part of your body can lessen the blood flow to tissues. Blood flow is essential to delivering oxygen and other nutrients to tissues. Without these essential nutrients, skin and nearby tissues are damaged and might eventually die. For people with limited mobility, this kind of pressure tends to happen in areas that aren't well padded with muscle or fat and that lie over a bone, such as the spine, tailbone, shoulder blades, hips, heels, and elbows. Another way a pressure ulcer can develop is through friction. Friction occurs when the skin rubs against clothing or bedding. It can make fragile skin more vulnerable to injury, especially if the skin is also moist. Thirdly, another way pressure ulcers can develop is through shear. Shear occurs when two surfaces move in the opposite direction. For example, when a bed is elevated to the head, you can slide down in bed. As the tailbone moves down, the skin over that bone might stay in place, essentially pulling in the opposite direction. The most common sites of pressure ulcers for bedbound patients are the back of the head, shoulders, elbows, buttocks, heels, ears, hips, thighs, and sacrum. When a patient comes into the hospital, they are assessed at their risk of developing a pressure ulcer. The most common scale used to assess the risk is called the Braden scale. The importance of assessing patients for pressure ulcer risk is due to the prevalence of pressure ulcers in older adults. It is also important due to how it can negatively impact a patient's life and how expensive it is to treat. Hospitals also lose money when a patient develops a pressure ulcer while in the hospital, so it's important to implement interventions to help decrease the risk of development of a pressure ulcer. The categories of the Braden scale are as follows: sensory perception, moisture, activity, mobility, nutrition, friction, and shear. Sensory perception is the person's ability to respond to pressure-related discomfort. So are they able to move on to a different side if they start experiencing pain, or are they completely unable to move themselves in bed at all? Moisture is the degree to which their skin is exposed to moisture. Are they incontinent often, or is their skin moist from sweat often? Activity is the degree they can perform physical activity. Are they up at their own liberty walking around, or are they bedbound or wheelchair bound and cannot walk? Mobility is a person's ability to change and control their body positions. Nutrition is the person's normal food intake. So how much are they eating? What are they eating? Do they drink enough water and eat the proper amount of nutrients? People do need enough fluids, calories, proteins, vitamins, and minerals in their daily diet to maintain healthy skin and prevent the breakdown of tissues. Friction and shear is their ability to move up in bed. So are they strong enough to pull themselves up in bed and move around if they need, or do they require people to help them move them up in bed?
Prevalence of pressure ulcer. According to the National Pressure Injury Advisory Panel, 72.5% are existing pressure ulcer cases globally. 6.3% are incidence new cases. In the United States, 836.9 pressure ulcer related hospitalizations per 100,000 adults occurred in 2016. Today, 2.5 million people develop pressure ulcer yearly. 25.2 happens in long-term care, 12% in rehab centers, and 9.7 in acute care. The National Consumer Voice for Quality Long-Term Care reported that the number of pressure ulcer occurring in nursing home care rose to 31% during the pandemic. Safety of care of hospitals in San Joaquin County versus national. Statesman Journal compared patient safety rate within San Joaquin County to the national rate. It defined safety of care as the likelihood that a patient will suffer complications while in the hospital or after undergoing certain inpatient procedures. Patients who develop hospital-acquired pressure injuries in San Joaquin County compared to the national rate were no different. However, looking at the 7 hospitals in San Joaquin County, Dameron scored the highest, followed by Kaiser, and then San Joaquin General and Doctors Hospital of Manteca rated third. Impact of pressure ulcers. Patients at risk for pressure ulcers are children, neonates, and the elderly due to their thin skin, patients who are paralyzed, disabled, or critically ill, and patients who are using medical devices, as these devices can press upon skin and over time create skin tears. Mortality also increases with pressure ulcers. 60,000 patients die every year as a direct result of pressure ulcers, and this is due to sepsis from the open wounds. Longer hospital stays and higher readmission rates also increases. A median access rate length of stay increases by 4.31 days, and a higher 30-day readmission rate goes from 17.6% to 22.6%. Along with this also comes increased cost of care. Patient care cost per pressure injury is between $20,900 to $151,700. It was estimated that $26.8 billion was spent on pressure injury treatments in 2019. Furthermore, pressure ulcer can also decrease the quality of life. It interferes with activities of daily living and functional gains made during rehabilitation. It also causes disturbed body image within the patient, and that can lead to low self-esteem and depression.
Preventing pressure injuries. Constant exposure of skin to moisture can cause skin damage and increase risks of pressure injuries. It is important to ensure good personal hygiene. Clean with mild soap and water and pat dry. Use barrier creams or skin protectant. Keep skin well moisturized. Preventing pressure injuries. Early prevention. It is important to assess skin frequently, educate patient early signs and symptoms, turn patient every 2 hours to relieve pressure off bony prominences. Early detection of pressure injuries equals less damage to the skin and increased healing time. Some interventions you could do range of motion, passive range of motion if bedridden, elevate legs when laying in bed, keep sheets wrinkle free, staying active if patient is able to get up on their own, using pillow to relieve pressures, protecting injured skin, keeping skin dry and intact.
There's a wide variety of interventions used for pressure ulcers. Some common interventions are the Prevlon boot heel protectors to help reduce the risk of pressure ulcers by keeping the heel floated, relieving pressure. Prevlon boots have a cushioned bottom that floats the heels off the surface of the mattress, helping to reduce pressure. The Mepiplex border, sacrum, and heel dressings are self-adherent, multi-layer foam dressings designed for use on the heel and sacrum, aiming to prevent pressure ulcers. The dressings are used in addition to standard care protocols for pressure ulcer prevention. Vacuum-assisted closure of a wound is a type of therapy to help wounds heal. It is also known as a wound vac. During the treatment, a device decreases air pressure on the wound, and this can help the wound heal more quickly and protect against infection due to a closed environment. MediHoney is a brand name wound and burn gel made from 100% Manuka honey. MediHoney is great at pulling moisture from wounds and dehydrates bacteria. Basically, this means it decreases bacterial growth within the wound. It also has an anti-inflammatory effect that helps speed the healing time of existing wounds and reducing pain. Wound cleansers are rinsing solutions used to remove foreign materials on a wound surface and its surrounding skin. Wound cleansers are cost-effective and means to promote wound healing and reduce the infection rate. The Mepiplex heel is a shaped foam dressing designed for wounds occurring on the heel. Mepiplex heel minimizes pain in wound or skin damage at dressing change. Mepiplex heel's absorbency effectively manages wound exudate. The conformability of the dressing allows it to easily and comfortably fit on the heel.
Treatment and healing. Protein, vitamin C, and zinc are important to promote healing. It is important to drink at least 6 to 8 glasses of water a day. Some of the proteins and food intake that promotes healing are beef, tofu, beans, pork, eggs, poultry, fish, and nuts. There's a lot more, but the most important is early detection. It increases healing time and it prevents further injury. And then it is very important to have the proper treatment for the different types of pressure injuries.
Resources: Sutter Tracy Community Hospital, Dameron Hospital, Lodi Memorial, and St. Joseph Medical Center are hospitals within the San Joaquin County that offers wound care. For those who don't have health insurance through their work, may apply for Medi-Cal, Medicare, or discounted health plans through Cover California to help cover their medical expenses. Having a good diet is important for wound healing, so the San Joaquin Public Health website and nutrition.gov are great websites that provides information on nutrition and food assistance programs for families and the elderly. Biden administration announced the Nursing Home Improvement and Accountability Act of 2021 recently, and if passed, it will focus on improving nursing home care and tackling the problem of inadequate staffing. The bill is linked here for additional information. For San Joaquin healthcare providers, here are 2 links that they may find beneficial in helping them prevent pressure ulcers in their patients.